Good evening, everybody watching on Facebook. It is alive. Monica makes it happen. Facebook show. Thank you for watching. And tonight it's a special happy Mother's Day to all the moms watching out there and grandmas watching out there. It is Maternal Health Awareness Week. And did you know that nearly 1 in 8 women experience postpartum depression after giving birth? That's according to the CDC. Tonight, we're joined by 2 incredible doctors, my favorite people on planet Earth. I can't believe we got both of you in one show. I mean, this is, if you're not, if you're watching, make sure you share, you like, you definitely comment, because right now the specialty that we have right now and the expertise in the house is top notch. And doctors, Dr. Gaither is here with us, and Dr. Gardere, we call him Dr. Jeff. So what we have is an OBGYN, and we also have, of course, do we say a therapist, or what do you like to be called? What's your specialty?
Therapist, clinical psychologist. You can call me anything you want to. Just don't call me late for supper.
There you go. And it's all about mental health, but also physical health. And, you know, the two are so intertwined. So I love that we have both of you here and the expertise of both. So don't forget to ask questions right now if you have them. But starting out with Dr. Gaither. Doctor, what is postpartum depression?
Postpartum depression is a form of depression that is seen in women right after birth.
And, you know, what differentiates it between, like, if you're just having the baby blues, like what makes it different?
Well, you know, when we're talking about these types of illnesses post-birth, it runs in a spectrum. You've got postpartum blues, postpartum depression, and then postpartum psychosis. So when we're talking about postpartum blues, this is something that typically lasts within a 2-week period. So what you might see are, you know, irritability, sadness, the mother feeling overwhelmed, trouble sleeping, appetite issues, mood swings. So that should last within about a 2-week period. Now, if it becomes longer than that, then we start getting into postpartum depression, where it's anhedonia, the same thing with the mood swings, excessive crying, sleep depression, feeling hopeless, feelings of inadequacy. And then we start thinking about postpartum psychosis when you start having confusion, disorientation, hallucinations, hearing voices, and thoughts about harming yourself and or your baby.
Oh my God. And everyone watching on Facebook, it's important to know fact versus fiction. So if we can do this quickly with you right now, let's do fact or fiction. Do you mind? PPD always occurs within the first few months after childbirth, right after childbirth. True?
Typically,
yes.
Yes.
And then what about, can it be prevented?
I don't think that you can prevent it. I think that, you know, it is thought to be hormonally mediated. I think that it occurs more frequently in women who have an underlying psychiatric issue, be it depression, bipolar illness. So I don't think that it can be prevented.
And Dr. Jeff, if you want to chime in on this one, mothers are the only ones capable of experiencing PPD. Is that correct?
No. We sometimes see that fathers also may develop postpartum depression or the baby blues because they are part of that stressful situation that is going on. Though they may not have the hormonal changes, as Dr. Gaither correctly discussed, sometimes just, you know, being in that kind of a situation is very stressful for a father also.
It sure is. And women suffering from PPD do they almost always harm their babies?
It's rare that occurs. When they start having those types of suicidal or homicidal thoughts, then we're into the psychosis range.
We have a question from Cynthia watching from New Jersey. Hi, Cynthia. She wants to know, can you know for sure if you're experiencing postpartum depression? Do you get diagnosed by a doctor? Is that how it works?
Yes.
Yeah.
Your family members should notice changes in your behavior. You know, I think that when we start talking about this specifically, those who are close to you notice the changes probably before you even are cognizant.
You know, you really were so clear, Isabel, as to what we're talking about. And now, Dr. Jeff, if we could talk about solutions, what are some of the treatments for this? Like, let's say someone's watching and says, "Yeah, that's me. I'm suffering right now." What are some of the treatments? What would you suggest?
Well, I think Dr. Gaither may want to talk about immediately what is done if someone is in the hospital or you're still working with your OBGYN, and then I can come in and talk about some of the psychological things. Dr. Gaither, did you want to?
So, um, like I said, your family members typically are the first ones generally, or whoever is in the house around you, that pick up that something is wrong. There's always a 6-week postpartum check or even a 2-week postpartum check, depending on your clinical symptoms. And it's at that point that I think you should, or whoever is around you, bring it up to your physician, at which point your physician will probably, evaluate you, make sure there's no medical underlying issue, and then subsequently refer you for either psychological intervention or psychiatric intervention.
And that's where I would jump in and say one of the things that we want to look at, of course, therapy is very, very important, especially if you're heading towards some sort of a depression from the postpartum, something that is more enduring. But we also want to look at what can be done at home, right? What does your partner do? Your partner has to, first of all, validate your feelings. Yes, this is real for you. This is difficult. You're going through a baby blues or you're going through a postpartum depression. What can I do to be there for you? How can I help you? How do we help you with the sleep fragmentation? How do we get up as the partner and feed the baby and change the diapers and so on? So it's about giving a helping hand and trying to alleviate a lot of that stress. Sometimes you find that people get postpartum depression or, the baby blues simply because they don't have the support. And so that's why it's important that we evaluate, as the good doctor has said, what is happening at home. Family will see that and everyone pitches in.
You don't do it alone. This is a family thing. And Elle pops up because one of our viewers has a question.
Yep, I'm seeing a question coming in from Tonya Harris, who's watching from the Bronx, who writes, "My daughter had postpartum depression really badly. I thought that she was maybe being selfish with her kids, but this is a real thing. What would you say to somebody that maybe is feeling this way about their family member who recently gave birth and the best way for them to address it?"
To intervene and tell them, look, I'm seeing some changes in you. Perhaps let's go to the doctor and have a discussion, because I do think that there's something going on.
I also see another question coming in from Sonia Ramos, who says, would lack of interest in their newborn children be a symptom of PPD?
Yes.
Yeah,
Poor bonding, lack of interest, just not having that motherly bond. Yes, that's definitely a symptom.
And then for a new dad, Dr. Jeff,
Overwhelmed.
what would you say for a new dad? What are some of the telltale signs?
I think some of the telltale signs that we see with the moms, but more specifically with the dads or the partner, what we may see is that individual is becoming very agitated. They're becoming angry. They're having poor self-esteem with regard to screaming or saying that they can't deal with the situation. The lack of interest in providing the help, but really feeling overwhelmed also.
And another question, Savannah asks, would more time in the hospital post-labor help?
I think it depends on the symptoms. It depends on the symptoms that are being exhibited.
And then prior mental illness, Dr. Jeff, does it create a higher risk?
Yes, it does. And Dr. Gaither spoke about that. When we're dealing with someone who has a history of depression or who has bipolar disorder, or perhaps that has some other kind of affective mental health issue, or if they've had PPD before that, they may be much more at risk.
Can I tell you how many women are right now commenting and have questions? I'm so grateful for that. Everyone, stay tuned. First, Sharita, I know someone that was, and it was so hard and difficult, but she made it through with a lot of help, support, and love. Is that the key, that you can make it through with support and love?
That's part of it. Absolutely.
Jeff, Dr. Jeff?
Well, certainly therapy can help for people who may have a severe PPD or may find that they're going into the postpartum psychosis. Medication can help. But, I think we look at the holistic treatment, which is all of those things, perhaps minus the medication that's not always needed. And that, Dr. Gaither can talk about when we really need to look at that. But more than anything else, it is about getting the support and also looking at, Monica, what were the circumstances within which that person is coming into that pregnancy? Are they feeling overwhelmed to begin with? Do they have the financial resources? Are they in a relationship that may not be healthy? All of those things may put them more at risk for baby blues, but for a postpartum depression.
Yeah, and Al, there's a good question, right?
Yeah, I think this one's super important, especially coming up on Mother's Day weekend. Cynthia is writing right now, and she says, what do you do if you as a mom are experiencing PPD, but don't want to necessarily show or tell your family in case they maybe see it as a sign of weakness? Dr. Jeff, I think that one's for you.
Well, I think this is along the issue of stigma in talking about mental health issues or mental health challenges. I like that term better. And so the stigma is based around the myth that if you have a particular issue, in this case, having postpartum depression, that it's a weakness, it's something having to do with your character. So please understand, and we're telling you this, that's why Monica's doing this program. It's not about weakness. It's not about you being a bad person. It's about something that's natural, that does happen to many, many people, and you need help. If you don't get that help, the situation can get worse, or it can carry on for quite a while longer than it needs to.
Now, I really think this is important. We have so many questions, but Amanda, my producer, came up with this really great question. Let's say you can't afford mental health services. How do you handle this? And you need the help. Let's say you're struggling with PPD. Is there a way to cope at home, or what do you suggest for someone who's struggling maybe to pay for mental health services?
Well, I would say it's really important to understand that you do need family support. But when people say that they can't afford mental health services, I completely get it. But there are services that are available. There are services that are available through your local hospitals. In fact, there are clinics that will help you get insurance, that will help you get Obamacare, that will find resources for you. It may take a while, but that's why it's important that you have a family working with you, or being able to go on the net and seeing what services may be available there for you. But check, of course, with your primary care physician, with your OBGYN, and they have social workers who can also work with you.
And Lisa LaRosa just said, do not be afraid to ask for help. Let the doctor provider know what you're feeling. There's no judgment, and allow others to help you. It's really allowing others to help you, right? I mean, that's really the message. Sometimes that's the biggest hurdle.
Absolutely. I really do believe that it does take a village. In this case, it does, take the family to be able to help you, whether you have a partner or not. If it's not even family who's there may be friends, but there are support groups that are out there that you can explore. You don't have to do this alone. It is doing it alone that makes it much, much tougher.
So
Absolutely.
true. Dr. Gaither, message of hope for someone watching. There's so many moms tonight watching.
Reach out. That's the best advice I can give. Don't be afraid, because ultimately it's going to impact the health of you and your baby. And I'm sure you want to, have memories of your child and growing up. And so just reach out. No stigma.
Dr. Jeff?
I agree with Dr. Gaither. And the other thing that I think is most important is count your blessings. Count the blessing of bringing a life into this world. Sometimes there are birth complications. Sometimes there are some medical issues, but it is important to know that, whatever time you have with your child, every day, every moment is precious. So always look into the face of that child, no matter what it is that you're experiencing, and be grateful for that blessing.
I love that attitude of gratitude. And Sharita Young, if I could end with her comment, not getting help can be dangerous to the person and for the baby. It's no joke, not to be taken lightly. And I have to say, oh, there it is. Thank you so much. My producers, Amanda and Elle. And of course, to you doctors, we had such a powerful panel and discussion tonight. Happy Mother's Day to all of our moms and everybody watching. And thank you, doctors, for taking your time out. I think we really made a difference, hopefully, just for one mom. We've done our deal. We've done what we were supposed to do. Thanks so much. So happy Mother's Day to both of your families. And lots of love to everyone watching at home or wherever you're watching, from your phone, from your living room, from your classroom, wherever you are. Happy Mother's Day, everybody. Have a great weekend.